All right, so here's the next thing that they will test you on: measurements, conversions, and calculations. Now, when they talk about this, the main thing that they focus on is pediatrics. When it comes to pediatrics, there is a cap on how much blood that you can remove from your baby, from your patient, from your 1 year old. That calculation is from the weight and the height of the baby. All right. So that will be your answer. It will either be the weight to determine how much you will remove from that baby, or it'll either be the height as to how much you will determine. There is a graph for that. So in the lab somewhere, that information is provided to you, but know how to find that answer. Yes, Nita, can we pin this? Let's see if I can pin this. Here is that answer: weight and height of the baby times 3.2. That is what they mean when they talk about any measurements. Okay, so they focus more on the pediatric side. So do not forget that. Now, the next thing is law, ethics, and professionalism. When we talk about law ethics, we are talking about the consents. How are we communicating with our patient? How are we obtaining any type of information? What type of consent does a phlebotomist use? What kind of consent does a phlebotomist use? What kind of consent, you guys? Tell me. I'm eager to know. What kind of consent, what type of consent do we use? Implied, informed, or implied? Yes, Nita, you are right. Yes, yes. It will be implied consent or informed consent. This is where we speak to our patient. It's either to let them know, hey, this is what we're doing. I'm going to stick you in the right arm. Are you okay with that? Yes, I'm okay with that. Implied consent, informed consent. This is how we will communicate with our patient. Record keeping, that has everything to do with HIPAA. HIPAA. If you're keeping track of everything, it's privacy. So we're placing it in our filing cabinets and putting everything away. HIPAA, remember, is privacy. It's totally privacy. And we all know how to be professional. We know how to address our patients. We know that we're calling them by their first name, last name, and this is how we're identifying our patients, okay? When you are dealing with pediatric patients and they are afraid of what's going on,